Sure. Good morning. My name is Angela Byron. I am the Director of the Physician Practices at Valley Regional Healthcare, and this is my partner, Kelly Murphy. She is our project manager, and we actually brought her in. I'm just going to start with that project. So this is our brand new lunch. We just began our journey recently, and I quickly realized that this project was very big, and we really want to invest the right time and the right resources. And having all of the work that I had to do, I knew I wasn't going to be able to follow the project as closely and give it the attention I needed. So we brought in Kelly to partner with me and help us guide the project. So she really guides the grant proposal, she guides all of the steps that we need to do and the financial piece, and I'm doing all of the clinical operations, and she's helping with a lot of the collaboration. So this is, I think, a new partnership, but we wanted to share that because it's actually going very well. It frees me up and gives me the time to work on the clinical piece. We're helping to congeal kind of the clinical counterparts that we need while she focuses on the rest.
So our project has a number of components, and we'll go through them if you can't see them. Valley Regional is the lead organization. We have partnered with Counseling Associates, Susan Borsch, Dr. Susan Borsch, and her team. And I put this map up here just so you could see. This is the Valley Regional campus right here. This is Valley Primary Care, which is going to be the focus of our B1 initiative. And this is the Counseling Associates building. So they're close. We don't have that integration in one building, but they are close, and we're going to build around that relationship. Then in addition to that, we are going to be reaching out to Sue Ellen and West Central, Lake Sunapee VNA, TLC, Planned Parenthood of New England, as well as the, oh boy, I'm not going to remember the name. It's Oak something door. It's a partnership between ServiceLink, your organization, and Pathways, and I can't think of the name of it. There's a tag name, but anyway. So we're in the process of putting together what all of those relationships are going to look like. And as Angela said, we've got the initiative rolling, but it's a growing relationship. It's not, everything isn't etched in stone. Do you want to start with the?
Yeah, so a little bit about our project. So we have multiple primary care sites on the campus, and they're all fragmented, so they're all in their little different buildings. And we decided for this project we were going to highlight our family medicine and pediatric practice. So that's our Valley Primary Care practice. Working closely with those physicians, we identified a physician champion. We have the clinical staff, clerical staff, and we just had our major kickoff meeting. I'm going to try to fight that a little, if you can hear me. We had just had our kickoff meeting last month. We were really very excited. It was a very fun, everyone's got a lot of energy about the project. It really focuses on embedding behavioral health in primary care. And who doesn't want to do that for their community, right? For our patients. And that's what we struggle with a lot of the projects and chronic care conditions that our patients have. We don't have that embedded model so that there's a bi-directional approach to taking care of these patients as a holistic view. We had our first work group meeting last week with the help of Stephanie Cameron and Jessica Powell as our coaches to help us work through it, and it was really a fun meeting. We're developing our charter, so we're really just in the beginning phases, and we're really very excited about the project.
So the components, as Angela said, include the bidirectional referral system. We also are going to work on a pilot of a telepsych relationship with DHMC's Department of Psychiatry, which will be embedded within Valley Primary Care. We don't know what that looks like yet, but it's in the infancy, and it's as we move forward. Valley's also in the process of doing an EMR conversion. So we're trying to plan this strategically so it doesn't overwhelm the staff, but that will be a component that's going to be rolled out.
We are 33 days to go live of our new EMR. So those of you who have been through an EMR transition and conversion probably can understand the pain. But this project is so important, we really didn't want to wait to start it until after the conversion. So we're balancing both things, and it's going well. We're all still smiling. One of the big things that we added for this group, so in this primary care practice, they have medical assistants and receptionists, but they don't have nursing. So part of this project, Valley Regional actually decided they were going to fund a registered nurse, not through the grant, that it was going to be our commitment to this project. And what we're going to do with the registered nurse is use the nurse with her obvious expertise and skill set, but also embed care coordination in that role, because that doesn't exist. And that's a huge piece of where our patients get lost in the shuffle. Part of the grant, we are hiring a social worker, which is also a huge need for this project. So we're really excited to be expanding the team, giving resources that are really needed to make sure that we're taking care of our patients holistically.
And then the final component, which right now is a fluid discussion, is bringing on an AmeriCorps member that's going to work as a social navigator with patients and staff. The timeline for that we're still trying to work out, but that is over the course of this project something that we will be implementing. And then the other components are the same that all projects have, where you've got the core standardized assessment process, the shared care plan, and the multidisciplinary team as far as goals. So anything, that's about
all we
it.
have.
Anything? Yep, so that's it.
Thank you.
Thank you.